This time lo Facebook for imi interview na Dr. Bloimi, Dr. Rachael Dyer-Bare. Hem with me fala lo studio lo here. Good fala afternoon, Rachel.
Good fall afternoon to Fala. Good fall afternoon, every listener.
Yes, so today me fala happy to mas na for you able for come lo here lo studio for talk about him this measle outbreak where him happen lo Milo Pacific in one fala later or one fala ota lo Solomon ota put him up about government lo Solomon's ota Ministry of Health ota put him for anyone where ota travel go lo Solomon ota master protect against this fala measle outbreak. Yeah. So you sabe go ahead and talk about him this fala measle yeah.
Okay. Thank you, Jilian. So, I think a week or so ago, Ministry of Health and Medical Services blow Imelo Solomon Islands issued na this fala measles advisory. So, him basically for any travelers going into or leaving Solomon Islands na. So, him for protecting na Oketalo Solomon Islands against the measles. So as you may be aware of, Samoa barasa fatumasna from this fala measles recently staka picking die, I think 78 or so deaths na as of a few days ago. So Ministry of Health blame him try for preventing to this fala situation. So case blow Samoa kita find out that measles have in fact been taken into the country from New Zealand. So have now Solomon Islands Ministry of Health try for preventing this one from anyone taken go in. So kata issue na this fala advisory. So basically hem advisory hem for anyone where hem by arrive go and oketa break them down into Solomon Islanders and residents and oketa visitors. So for kita residents and Solomon Islanders, kita advice na is that for you must immunize. So if you already immunized, you must garem na this proof where hem been done. And if you no garem any proof or you no sabe if you immunized or you sabe that you're not immunized, you must at least garem one fala measles vaccination. So that's if you travel from New Zealand go to Solomon Islands, you must get them now one fala vaccination. Okay, ta must document him. So doctor where medical clinic where you take him from, ya must give him you proof that bata look him na time you arrive go na lo home. So him na for osem you me west up lo here by go lo home na. So and him okay ta by check too for okay ta where come from Solomon Islands come in lo leave him country or ta need him this proof too that ota in fact taken na this measles vaccine or MMR. So and then ota another things ota talk about lo advisory is that if you know save show that you got him this proof ota put you into quarantine. What ota call them quarantine na time you arrive go lo there. So basically by you stop selevan na lo house ose mota only people where ota by sa come kasem is those who are been immunized. But by you had to go anywhere na so by him para affect him now the plans blue for Christmas. So some best thing is for protect him him for protect him the people around you, especially now the babies where are too young to get vaccinated.
Okay, Rachel, one fala question lo here. Also, if person like me, if me like travel go to Solomon and me already immunized but me just not sure that me no got a record blomilo here that me immunized. How na by me go about him that one? Should me go look him GP blomi or what na me should do him?
Okay, so if you no got him record, you first thing for you doing now is you go look him GP blow you. Sometimes Boketa garam records, especially for the younger
Pikinini.
But yeah, ota might garam record, and if Boketa no garam record, and osem you, because I think you home but should garam na this baby book where him outline him na ota immunizations. But if that one no more too, then best thing noma is for you get them noma this MMR.
So if ota pikinini ulo here and ota go home, ota have to carry book block the baby book block talo here, yeah?
Yeah, well, or even just take him any printout noma from GP. So oketa bagarem records lota which show mosim record lota immunization. So him no have to be that book,
yeah.
But him just something where him official that show him that in fact him been immunized and oketa say I mean ideally tufala MMR vaccine, yeah, but at least one na ota specify lo here. But ota pikinin as long as you got some kind of proof. So GP have print him out or even write him letter or something or same for sure that him been done.
Okay, nara question more regards to that letter where the Ministry of Health ota put him up, yeah. Ota say 28 na ba him effective. So if you take him measles shots blow you this time, him you take 2 weeks not before him sa waka or him waka straight away. No.
Well, for full protection, him 2 weeks. So even lohia ota say if you by travel anywhere where him measles him or some high numbers, ota say at least 2 weeks na for give him chance for body blow you develop him strong na this immunity. So this law advisory ota say 28th December na ba kita start for enforce him na this fala two fala things we have to talk about if you arrive come and you know got proof ba kita quarantining you. So I mean some fella might think that him by go over before law 28 so him okay, but you must think about that by you still putting people at risk, just on the off chance that you know got him this immunity.
So if you know take him any sort it him good idea for just go to doctor and take him sort yeah, no ma?
Him correct Jilian. Him maybe by you yourself by you okay no ma kasi by you sicky you might no suffer too much but him just for protect him na general public o kita when no been immunized especially of the baby. So best idea na if you unsure or you no sabe show him this fala proof is for get him this vaccine.
Okay, another something. What the symptoms blow this measles? You sabi a little bit talk about him that one no good. Anyone ota got him symptom here but ota no even sabe to what na ya.
Yeah, okay. So the symptoms early stages noma any flu type sicky, so cough, runny nose, sometimes fever, and also red eyes red eye. But then one fella symptom where para characteristic or diagnosis blow measles na is this rash. And rash if you look him quite him different little bit and him how does I describe him start low head or face then him travel down low rest low body. So things yan na. So if any pikinin or any person him show up and him meet him criteria rash, fever, and got him good story and been in contact with him someone with the measles, especially been low Auckland, by start for teething or maybe measles by test for him.
So where like for example mi fala where taking finish ota vaccine lo home time mi fa pikinin it and then mi fala come lo here. But I'm still okay for mi fala. Is it still safe for mi fala just take him that shot just for but him no little bit affect him like health whatever for fala no more?
No. So if you already been taken shot there home time as a child use him okay for you take him again no more just
so tamba mi fala travel back what na ota like what na ba him prove lo mi fala because ota records lo mi fala home what na hana ba mi fa prove him that mi fala already taken these shots that mi fala pikinin
well by I think by need for find him way na for get him this record lo you physically, so whether him get them someone lo home for send them come across or something or same. But I think me no sabe lo where lo airport now kita by do him na this fella check from 28 but him sound the same if some way where if you got him this record him stop lo home but sabe bring him in for you. So so him ota say any record where him or him just legally no matter him show that you been got him vaccine him appropriate na.
Okay.
Yeah.
So like now Samoa barawa like very ota bara that measle him really affect him ota. When do you think Solomon Islands him rankle him now? Do you think that we are vulnerable to get it, or you may still like safe or what?
That one a little bit tricky question. I mean, I guess thing with them difference between Samoa and Umilo Solomons na is Samoa ota this thing called herd immunity, which is the proportion of population where oketa been vaccinated against measles. So lo Samoa ota hem low tumasya. So because of things were happen over the past few years, rates plot I think sit down somewhere around 30% no more. And for measles, ota say for protecting population, you need him coverage him over 90%. So 30% versus 90% him low to mas like. So also him na I think why time measles introduced, and cause measles him infectious for good. So I think one person with the measles I infect him up to 17 fala people that him come into contact with. So him na how contagious, him was him service spread easily. So going back to this thing about coverage, I think Yumi Lohom or him quite high. Some fala data mi luklo him say high 80s, even 90s. But also Yumi must consider him ota proportion of population where some ota too young for get vaccinated. So him na Yumi worry men oketa where maybe or some allergic or kind of. So I think if you may compare him Samoa and Yumi, that fala coverage or herd immunity him lo favorable Yumi against the measles. But him no mean that Yumi should relax about it. You still need for try and best for protecting health for everyone.
Yes, thank you now, Dr. Rachael, for come over here to studio and talk about this measle update for anyone where ready for travel go solo or for protecting family below you. Me very happy to must that you come to studio. Any last advice for the listeners out there where are ready for travel?
Yeah, I think him just if you know garem nomas any evidence for sure, then him best noma that you go take him noma nilaya. Ministry of Health him lo New Zealand na oketa putum tu lo advice blocketa so every GP nurse practice whatever out there should serve na that Solomon Islands have been issued this advisory. So oketa savena, so anyone come from Solomon's him requesting vaccine, ota should give him free, like give him as requested. And if anyone him go in and him little bit having problem or some resistance from oketa practice, just say no ma Ministry of Health of New Zealand him put on this one low website, and if oketa save go look lo there. So him no ma I think last advice is if in doubt or for protecting health for everyone, just go get them no ma this vaccination.
Okay, thank you too much na Rachael. All the best. Hello Christmas below you, whatever by you doing, and thank you too much na for come to studio.
Thank you, and Merry Christmas everyone.
Thank you.
Thank you so much.
Yeah, him na Rachael imigolo one fala song lo here. Him ya Paiva and Renata, and him say Sweet Sound.
Sweetest sound I'll ever hear, the nicest words I'll ever